Hello, my name is Billy Williams with Medicare Health Insurance Options. In this video, we're going to talk about the different parts of Medicare. That is, the different letters, for example, Part A and Part B and so forth. This can get a little bit confusing at times, so we're going to look at each part of Medicare and explain it. So we start off with Part A. Part A is called hospital. Next is Part B. Part B is called medical. Then we have Part C. This refers to Medicare Advantage plans. Last, we have Part D, which refers to prescription coverage. Part A is called hospital. It's relatively self-explanatory. If you have Medicare and you are in the hospital, then you are covered under Part A. This will also cover you if you are in some other similar facility, such as a skilled nursing facility, a rehab center, or hospice care. There are times when this can get a little bit confusing because you can be at the hospital but not technically in the hospital. What that means is, for example, you could be at the hospital in the emergency room. You could go to the hospital and have some type of a procedure in the outpatient day center and are then sent back home that same day. So you're at the hospital, but you were never admitted to the hospital. The more confusing situation is where you may go to the hospital, you may enter through the emergency room or some other means, and you are actually kept overnight at the hospital for observation, but then are never officially admitted to the hospital. So that's where it gets confusing. But if you are officially admitted to the hospital, then you will be covered under Part A of Medicare, which is hospital. Now, for most individuals on Medicare, the majority of the medical care that you will receive throughout each year will be covered under Part B, which is called medical. So basically, Part B of Medicare is any medical care that you need that is not covered under Part A. These include many different common situations. For example, if you were to go to your doctor for a doctor office visit and receive care at your doctor's office, in addition to a doctor visit, you might then, of course, also be sent to somewhere to do blood work or some other lab work. You might be getting x-rays. You might be receiving some type of treatment. This also would include if you were in the need of the ambulance, if you're treated at a hospital emergency room, if you have home health care, or if you need durable medical equipment and so forth. So any medical care that is covered by Medicare that is not a hospital stay will be covered under Part B. Next is Part C. If you have a Medicare Advantage plan, then you are covered under Part C. A Medicare Advantage plan is going to be some type of a network policy, either an HMO or a PPO. On a Medicare Advantage plan, all of the benefits that you would normally receive under Part A and Part B are included. Most Medicare Advantage plans also include prescription coverage. Sometimes a Medicare Advantage plan will also include some other added benefits as well. Next is Part D, which is prescription coverage. If you have Part A and Part B of Medicare as your main coverage, you then also have the option to get a separate standalone Part D prescription drug plan. The prescription plan is designed to assist you to save money on the cost of your prescription medications, and this is optional coverage in addition to Part A and Part B. If you are enrolled in Part C, which is a Medicare Advantage plan, then most likely this Medicare Advantage plan will include your prescription coverage. So there you have it, Part A, Part B, Part C, and Part D. I hope this brief explanation has been helpful to clarify the different parts of Medicare. If you would like to discuss this in more detail, I would certainly be very happy to discuss any of your Medicare needs with you. We're an independent agency. We specialize in the senior market, and our services to you are always free. We help individuals who are turning 65 in the near future and getting ready to start Medicare. We also work with individuals who have been on Medicare for a number of years and would like to have us look at their current coverage to make sure that whatever plan letter, whatever premium they're paying now is the best value. Please give us a call and we would be happy to discuss your options. Our phone number is 800-499-1942. I also encourage you to subscribe to our channel so you will get other valuable videos sent to you in the future. Also, if you have any questions or comments, please comment below. Thank you again for watching our video.